This video provides a brief review of the NHTSA standards for administering the horizontal gaze nystagmus test, or HGN test, utilized by state, county, and municipal law enforcement officers in North Dakota. The HGN Standard Field Sobriety Test is scientifically validated and is admissible as evidence in the state of North Dakota. However, the test must be administered accurately in order to provide reliable evidence and in order to present a strong case in court. Whether you're a new law enforcement officer or a seasoned veteran, it can be helpful to review and refresh your knowledge in order to bolster your confidence when administering the HGN test and testifying about it in court. Asking clear questions, giving clear instructions, and watching the details will help you avoid common pitfalls and make your testimony more credible. Remember, in addition to being a sign of impairment, the presence of HGN may also indicate consumption of other controlled substances, such as seizure medications, phencyclidine, a variety of inhalants, barbiturates, and other depressants. In this situation, it is always a good idea to contact a DRE to assist with the investigation. As a professional, this will all be very familiar to you. Still, I encourage you to watch for things you may have forgotten, to refresh your skills and knowledge, or for tips to help you be more confident the next time you are asked to testify. The HGN test is easy to administer, even in conditions that may not allow for the one-leg stand or walk-and-turn test to be conducted. Though we all know how the tests are to be done, it's easy to rush through a step or give unclear instructions. It's also easy to forget details or become flustered when defense attorneys try to plant a seed of doubt. So let's walk through the administrative procedures. First, make sure the subject is facing away from traffic, as well as flashing or strobe lights, which may limit any arguments regarding the presence of optokinetic nystagmus. Avoid dust, wind, or other potential eye irritations that can provide the defense attorney with something to challenge the test results. Begin by checking for contacts or eyeglasses. Ask the subject to remove eyeglasses if they're wearing them. Next, ask the subject questions to determine whether any medical condition or disability might affect the validity of the test. Give clear, concise, step-by-step instructions. Then use a mental checklist to repeat the main points from the complete set of instructions. This helps to ensure the subject understands and that you have not missed any steps. Make sure the subject knows to keep looking at the stimulus until you tell them the test is complete. Position the stimulus 12 to 15 inches from the subject's nose and slightly above eye level to start the test. This height forces the subject to open their eyes wide so the officer can better see the presence of nystagmus. Check for resting nystagmus, a type of nystagmus observed as the eyes stare straight ahead, and note if present. Check for equal pupil size. If pupil sizes are noticeably unequal, it could be a medical condition or injury that needs attention. Then check to see if the subject's eyes contract by moving the stimulus from center to far right, to far left, and back to center. Use the same speed as if testing for lack of smooth pursuit, approximately 2 seconds. If the subject's eyes cannot track, it could also be a medical condition or injury that needs attention. Otherwise, begin the administration of the test. Take a brief pause, then begin testing for lack of smooth pursuit. Check the left eye by moving the stimulus smoothly all the way to the right, or the subject's left, until the eye cannot go further. As you do this, move the stimulus at a steady speed, taking approximately 2 seconds to bring the eye all the way from the center to the side. Check the right eye next, by moving the stimulus at the same speed, all the way across the subject's face to the left side, or the subject's right, until the eye cannot go further. Move the stimulus back to center. Make at least 2 complete passes for each eye. If not impaired, the eye should move smoothly. If impaired, the eye will jerk like a wiper on a dry windshield. Record 1 clue for each eye that shows lack of smooth pursuit. Next, we check for distinct and sustained nystagmus at maximum deviation. Once again, hold the stimulus 12 to 15 inches in front of the subject's nose and slightly above eye level. Check the left eye first. Move the stimulus from center to far right, or the subject's left, until the eye has gone as far as possible and no white is visible in the corner of the eye. Hold the stimulus steady at that position for a minimum of 4 seconds, and carefully watch the eye. A word of caution. A common pitfall happens at this point when officers do not count the minimum of 4 seconds before moving on. Defense attorneys may be able to cast doubt on whether the officer watched long enough for clues. The best practice is to make sure the stimulus is held at maximum deviation for a minimum of 4 seconds. Check the right eye in the same way. Move the stimulus all the way across the subject's face to the left side, or the subject's right, until the eye has gone as far as possible and no white is visible in the corner of the eye. Again, hold the stimulus steady at that position for a minimum of 4 seconds, and carefully watch the eye. Make at least 2 complete passes for each eye. If impaired, the eye is likely to exhibit definite, distinct, and sustained jerking when held at maximum deviation for a minimum of 4 seconds. If you only see slight nystagmus, or if you have to convince yourself it's there, it is not distinct and sustained. Record one clue for each eye that shows distinct and sustained nystagmus at maximum deviation. The next part of the test is a check for the onset of nystagmus prior to 45 degrees. With the stimulus 12 to 15 inches in front of the nose and slightly above eye level, check the left eye by moving the stimulus from center to the right side or on the subject's left. Move the stimulus at a speed that would take approximately 4 seconds for the stimulus to reach a 45-degree angle from center. When you see jerking, stop and hold steady in that position to verify if jerking continues. If it does, you have located the point of onset. If jerking is not evident when holding steady, you have not located the point of onset and should continue moving to the side. Once the point of onset of nystagmus is located, you must determine if it was reached prior to arriving at a 45-degree angle. You can estimate this both by looking at whether there is still some white of the eye showing and by determining whether the stimulus is an equal distance from the center to the side. Some officers use the edge of the shoulder as a guide. After checking the left eye, check the right by moving the stimulus towards the left side or subject's right in the same speed and manner. When you see jerking, stop and hold steady in that position to verify if jerking continues. Once again, determine whether this is the point of onset. If not, continue moving to the side. When the point of onset of nystagmus is located, again determine if it is prior to a 45-degree angle. Make at least 2 complete passes for each eye. Record one clue for each eye that shows onset of nystagmus prior to 45 degrees. This is the time to tabulate the clues you've recorded. There's a maximum of 3 clues per eye, with a total of 6 clues. If 4 or more clues are present, the subject is likely to have a blood alcohol content of 0.08 or greater. In other words, 4 or more clues is an indicator of impairment. At this point, checking for vertical gaze nystagmus, or VGN, can provide valuable information and add even greater clarity. Begin by positioning the stimulus horizontally this time, about 12 to 15 inches in front of the subject's nose. Instruct the subject to hold their head still and follow the stimulus with their eyes only. Raise the stimulus until the subject's eyes are elevated as far as possible and hold it at that height for a minimum of 4 seconds. Watch for evidence of the eyes jerking upwards. For vertical nystagmus to be present, the jerking must be distinct and sustained for a minimum of 4 seconds at maximum elevation. Make at least 2 complete passes. If present, it can indicate a high dose of alcohol and possibly certain other drugs for that individual. Let's watch the entire test demonstration now. Do you have any physical or medical disabilities that I should be aware of?
No.
Do you have any problems with your head or your eyes?
No.
I'm going to do a test, just checking your eyes. Can you see the tip of my finger okay?
Yes.
Do you mind removing your glasses for me, please? I'm just going to move my finger back and forth. I just want you to follow it with your eyes and keep your head still during the test. Do you understand?
Yes.
Okay, I'm going to go up now, all right?
Okay.
Okay, you can put your glasses on and relax. A 1998 validation study found that HGN is still the most reliable of the standardized field sobriety tests, and if administered correctly, is 88% accurate in guiding officers in making correct decisions to arrest. Administered properly, the HGN test can provide you with a high degree of confidence in observing clues associated with impairment. Additional resources, including SFST and DRE training instructors, are available for your agency or department. Contact the North Dakota Highway Patrol for more information.